Good afternoon, everyone. I'm Hyekyung from the Department of Social Work in NUS. Yeah, as introduced, I'm a Korean, but yeah, I worked here in Singapore for some years. Yes, And before begin my presentation, I would like to clarify something. In fact, the findings from the data I'm going to present, which is given by a community counseling intervention for pathological video gaming, not to be released to the public or in media outside of this conference, because the findings are still premature to be conclusive, and also our collaboration with the agency is still ongoing, and plus there's an agreement on the confidentiality and privacy of the collaboration between the agency and myself and my research team. So if you respect this arrangement for the confidentiality and privacy of the collaboration and the findings, I would appreciate it very much. And now we are revisiting pathological video gaming. Previously, Dr. Sim introduced the intervention conducted by Touch Cyber Wellness for the pathological video gaming. Now I try to look at the profiles of pathological gamers and their families. Still, the problem of pathological video gaming or the video gaming addiction exists or not is much in debate. However, across the different studies, in fact, the pathological video gaming is defined rather consistently as gaming activities that damage the individual's social, occupational, family, and school, and psychosocial functioning with some addictive symptoms like preoccupation, tolerance, or loss of control, withdrawal, and escape. The prevalence of pathological video gaming has been explored in various countries, in fact, using more or less similar measures of pathological video gaming. So if you look at these graphs across different countries, you can see the prevalence rate of pathological video gaming. Any country would be around like more or less 10% of all the gamers investigated in those studies. However, whether all the gamers actually seek some systematic professional help or not is largely unknown. Even though the legitimacy of the pathological video gaming is still in debate, people do suffer from this problem. The pathological video gaming or excessive gaming, in other words. And then they seem to need some help. Not just any personal help kind of things, but more systematic and professional help. But not all pathological video gamers seek professional help. Well, according to the data I have, about 13% of pathological gamers from a school sample have sought school or other counseling services for their video gaming problems in the past year. So the vast majority of pathological gamers, although suffering from the pathological video gaming, actually do not seek professional help. So it is very important to understand the profiles of pathological gamers who haven't sought any professional help, and also the pathological gamers who have sought help for their problems from the community counseling agency, or the pathological gamers under treatment for other psychiatric problems. So my presentation has two aims. One is to document and describe demographic and family profiles of pathological gamers from 3 different samples. One from school sample and another one from clinical sample, who are the outpatient in a mental health clinic. And another group of sample is from community pathological gaming intervention group. And looking at the profiles of these different group of pathological gamers, I try to provide some implications for outreach and intervention strategies in clinical and the community settings. Okay, I used 3 different sets of data. One is survey data from a school sample, and then another one is from a clinical sample. I mean, for the clinical sample, we have used the same questionnaire. And then another set of the data is from a community counseling agencies. I mean, particularly from the former clients who participated in the community counseling intervention program. So this data set has different the variables and the fields in the data, because it wasn't really like the survey data, but it's from their case records. And then from each sample, I selected the children and adolescents who are at age of 9 to 15 years old. And then the variables, I look at the common variables across the 3 data sets. And first thing I looked at is number of pathological symptoms and number of hours spent on gaming per week. And also the basic demographic information such as age, gender, family structure. Family structure as in whether they live with their both biological parents or not. And also I looked at presenting family issue, which I will explain later in the measurement section. And also the family environment and parent-child closeness and parental restriction on child gaming and parental mediation on child gaming. And using those 3 data sets, I divide the samples into 4 groups according to the pathological status. The one group is non-pathological gamers from a school sample, about like 1,800, almost like 2,000 the primary and secondary school students. And another group is pathological gamers from school sample. It's about like less than 10%, so only 143 pathological gamers could be drawn from that school sample. And also I have another group of pathological gamers from a clinical sample, which I mentioned already. And then the 4th group is the pathological gamers from a community intervention group. The pathological gaming was measured with 10 yes, no, sometimes items adapted from DSM-4 criteria for pathological gambling, which is quite common in other studies as well. If they report 5 or more symptoms in total on this the scale, then they are considered as pathological gamers. So there are some the sample example items here. And the family environment was measured with an index score from 6 items on 4-point Likert scale, 1 for strongly disagree, and then the 2 for strongly agree. 1 for strongly disagree, 2 for disagree, 3 for agree, and then 4 for strongly agree. I'm so sorry. And then the higher number indicates, I mean, if the 3 or 4 points, that means they agree to the positive statement about the family environment. So higher number indicates the positive perception about family environment. Lower number, like a 1 or 2, would indicate the negative perception about their family environment. And then we also measured parent-child closeness in the same fashion, using 6 items on 4-point Likert scale. Again, the 3-4 points indicates positive perception about their parent-child closeness, whereas 1-2 lower points indicate the negative perception about their parent-child closeness. And then the potential presence of family issue. In other words, the presenting family issue. Well, the 2 data sets, I mean, school sample data and then the clinical sample data were collected through the same questionnaire, same survey questionnaire. But like I said, the data from the community counseling agency, it's not a survey data. It's from the case record. So it was a bit, there was inconsistency between the data set to find out about the family situation. So one thing I did is from the survey data, I look at the total index score for the family environment, and then the parent-child closeness, and then if the index score is 2 or below, meaning they strongly disagree to the positive statement about the family environment or the parent-child closeness, they are considered, these indications are considered as the presence of family issue. Yeah. And then when I look at the community counseling agency data, there was no measure of family environment or parent-child closeness, but they do have the treatment goals for each individual clients. Usually it's a few, 2 or 3. So among these 2 or 3, the treatment goal, intervention goals, in other words, if I see any family issue indicated, for example, like the parents need more positive parenting skills, or the child needs better relationship with the parents, or something like that, then I take it as one. Take it as a one count for the presence of family issue. So that's how I compare. How I made these different data set rather comparable for this analysis. And then parental restriction on child gaming. It was measured as an index score of 5 items using 4-point Likert scale. It's a frequency scale, so 1 for never, and then 4 for every day, or almost every day. So it's about children and adolescent respondents report about their parents' restrictive the supervision on their gaming, how often they do that. So for example, like my parents set limits on how long I may play video games, or my parents make me ask permission before I play video games, and etc. These kind of the items were included to measure parental restriction on child gaming. And also there are some items, like 5 items on the parental mediation on child gaming. Also, index score of these 5 items was used on the 4-point Likert scale again. But the parental mediation items are like, my parents point out good things about playing video games. My parents explain the reality behind video games, and etc. And then, okay. And then these are the results of analysis. In this presentation, I'm just going very purely descriptive. I do not try to make any inferential interpretation of the data, whether the difference is significant or not, because the aim of this presentation is to give you the profiles of the characteristics, especially the demographic and familial characteristics of the pathological gamers from 3 different samples. So anyway, if you look at the number of symptoms of pathological gaming, in fact, these 3 groups, these 3 groups of pathological gamers, from school sample, from clinical sample, and community agency sample, you don't see much difference. They are all around like 6, out of 10 pathological symptoms. But if you look at the number of hours spent gaming per week, then you will see more contrasting difference between these 3 groups, meaning the community counseling agency, they take the pathological gamers with the highest number of hours spent on gaming. In fact, they are really working with the real hardcores among pathological gamers. But if you look at the pathological gamers from school sample who have not sought any help, professional help, the gaming hours per week is rather lower than the clinical sample or the community intervention group. And then age-wise, they are mostly in secondary schools across the 3 different samples, but the pathological gamers from clinical sample. They are in primary school age, a lot younger than the other two. And of course, the pathological gamers, I mean the gamers in general, usually they are predominantly boys than girls, yeah, the males and then females. But if you look at the pathological gamers, yeah, you could see more boys, yeah, almost like a 90%. So boy to the girl ratio is 9:1. But if you look at those under treatment for some other psychiatric problems, or those who are participating in a community video gaming intervention program, then it's almost all of them are the boys. Yeah. So I can say maybe the girls are missed out. Yeah. In terms of receiving some professional help for their gaming problems. And then if you look at the family structure, as in the living arrangement, I mean, whether they live with both biological parents or live with single parents or or mother or father and the step parents, or like with grandparents only or with guardian, then one thing you can notice is, the pathological gamers from clinical sample, a quarter of them, in fact, living in non-intact family, so-called, So this group needs more attention for their family context. And also other family characteristics, the presence of family issue, presenting family issue. Pathological gamers from school sample and also pathological gamers from clinical sample, you don't see much difference. But if you look at the pathological gamers who participated in the community counseling program, then about almost a quarter of them actually indicated they need some help to improve their family relationship or the family environment. Well, I mean, the difference may be mostly due to the different way of structuring the data. As I just told you, the school sample, clinical sample, we use the same survey questionnaire, but the community intervention group, we didn't use the same survey questionnaire. So maybe the difference could be because of that, but anyway, at least a quarter of pathological gamers who participate in the community intervention program, actually they wanted to resolve their family issues in one way or another. And the parental restriction on gaming and parental mediation on gaming, overall score is around like a 2, slightly above 2. That means is it around like once a month the children found their parents actually meddling in their gaming, the behaviors. Like, sometimes they set the limit, sometimes they just talk about the gaming, but the frequency-wise is around like once a month, over and below, once a month kind of, the mediation. So summary of the profile, despite little difference in the number of symptoms, the hours spent on gaming per week range actually the 37.8 to 50.7 hours among pathological gamers across different samples. If you look at the non-pathological gamers, it's around like 20 hours per week, meaning like about 2 to 3 hours playing gaming a day sort of. But if you look at the pathological gamers profile, then it's a lot higher than that. And the pathological gamers from the clinical sample are at the age of primary school. And almost all pathological gamers in clinical setting and the community intervention program are male. And about 25% of pathological gamers in the clinical sample do not live with both biological parents. And about 13 to 14% of the pathological gamers in school and clinical samples indicated potential presence of family or parent-child relationship-related issue, whereas about 24% of pathological gamers in the community intervention group indicated such an issue as a treatment goal. Usually, overall, the family environment is perceived rather negatively by pathological gamers from the clinical sample. Yeah. Which is below 3 means, on the average, they don't really agree to the positive statements about their family environment. And overall, the 4 groups perceive their parent-child relationship to be on the positive continuum. On the contrary. Average index score is over 3, which means they strongly agree before the strongly agree about the positive statement about their parent-child relationship. And the parents of pathological gamers in the school and clinical samples were found to exert restriction on their child gaming slightly more than once or twice a month. To the children's perception, their parents, not every day, but once in a while, once in 2 weeks or so. And also parents of pathological gamers in the school and clinical sample were reported to use mediation approaches to their child gaming about once or twice or less a month. Because the index score is slightly around the 2, meaning, mostly below. So they use mediational approach to their child gaming, less than once a month or twice a month, So my suggestion for outreach, in fact, the pathological gamers identified from the school sample, they haven't sought any professional systematic help. So they are the target for outreach if you are talking about some intervention for pathological gamers. So one thing we need to note is the magnitude of pathological symptoms among pathological gamers, regardless which sample we actually draw from. Even those are not seeking help. The magnitude of the pathological gaming symptoms, in other words, the 5 or above, they do have very similar number of symptoms. In the school sample. They do not necessarily have a less serious pathological video gaming problem, although they haven't sought any the counseling or social interventions at all. So we need to pay attention to that. And also the outreach effort needs to focus more on secondary school than primary schools. As you just saw, the data was actually collected from primary school students and secondary school students, but the average age is mostly on the secondary school age. So more active outreach should be made in the secondary school settings rather than primary. And then the outreach effort needs to be extended to male students with a video gaming problem, as I mentioned just before. And also the unfavorable family environment can be considered as well. Although, overall, the pathological gamers, they perceive their family environment not in a positive light, And the pathological gamers in the clinical sample, but they are mostly primary school students. The problem is the research on gaming addiction, pathological video gaming, mostly is done with the secondary school students, adolescents or young adults. We don't look at much about the primary school student, younger children. So maybe the pathological gamers identified in the clinical setting, they may have a different developmental needs that needs to be addressed a bit differently from that of the adolescent pathological gamers. And also the family situation, especially the family structure and the family environments needs to be understood in the clinical settings as well. So usually in the clinical settings, meaning the outpatient in mental health clinic, they tend to provide the psychiatric services, meaning the medical services, medical treatment mostly, but they shouldn't really overlook the family issues, and maybe in their assessment or the referrals to the social workers, other clinicians, they need to look at this aspect of the problem as well. And then for pathological gamers in the community intervention group, well, the community counseling agency, they really work with the hardcore gamers who plays like about 50 hours per week, So maybe the number of symptoms are more or less similar across different samples, but the number of hours spent on gaming per week is extremely higher in this the sample. So the reducing the number of hours spent can be a quite challenging goal for the intervention in the community counseling agency. Yeah. So maybe the time management components or the controlling their gaming habits could be the main point for intervention in the clinical, the community intervention agency. Huh? And also, they also need to provide family support services for clients, parents, and families as well, as indicated in their case record as a main treatment goals. Yeah.